Autism Awareness segment is brought to you by Hopebridge.
Boy, do we have a special treat for you. I'm joined by my good friend Kim, who happens to be the CEO of Hopebridge?
Actually, the founder.
The founder.
The founder and the chief clinical officer.
For folks that may not know exactly what Hopebridge is, we've done plenty of segments following Homer, which has touched many people in the Wabash Valley. But for folks that may have tuned in, what exactly is Hopebridge?
So Hopebridge is a center-based treatment model for children on the autism spectrum. And our therapies are really focused at helping children with autism transition to school successfully.
And so being the founder, I love your story. I mean, why this? Why did you start all this?
My background is occupational therapy, and I spent many years working in the early intervention system and with children who, at that time, we weren't diagnosing that early, but I really felt these kids had more intensive behavioral concerns that could benefit from an intensive behavior treatment program and a collaborative approach with OT, speech, and feeding. And so I just decided that I was going to try to be that solution.
And amazing things are coming from Hopebridge. As you can see the footage right there, we're working with little ones one-on-one. But let's talk about some of the therapies that you do. ABA therapy, the one-on-one, what exactly are those?
Yeah, so ABA therapy is a one-on-one treatment approach, and as I said, we are working at trying to prepare children to successfully transition to school. We're going to work on social and play skill development. We're going to work on language and communication skills, decreasing problematic behavior, helping improve attention and focus, all those things that they need to be successful in school.
And let's talk about early detection, because that's something that's really important for parents as well.
Absolutely, and that's one of the big things that has changed over the last decade, is that we have now really seen a transition to early identification and early intervention. So we can reliably receive a diagnosis as early as 18 months, which is just amazing.
Yeah.
But the literature supports that intervention should begin between 2 and 7. So it's a great opportunity for children and families to start an ABA program, get that intervention early, and then transition to school successfully.
What do you tell those parents at home that are teetering, that they're nervous to walk into the doors of Hopebridge, or they may, be in denial, like, no, not my kid. Like, what do you say to them? Because it can be scary.
It can be very scary. And at that age, the child is still really working on just obtaining normal developmental milestones, and so sometimes the inclination is just let's wait and see, and maybe they'll catch on. And I guess what I would say is you better to start early. At least check it out if you have concerns or there's red flags, because the earlier that we can begin an intervention program, the more likely they're going to not need intervention later on. And that's the goal, is that they can be in school with their peers and not need the additional support.
Personally, what is it like to see those kids walk through the doors at Hopebridge and watch them from start through maybe a month or 2 months into the different therapies, and you see that light and they get it? Because I personally, I've seen it when I go in, but what is it like for you?
I was going to say, I know you've been there, so you've seen just kind of the magic that occurs there, and obviously your following of the Homer story, I think, really highlights and shows taking a child that's basically nonverbal, who is now being able to communicate verbally, and it is just one of the most rewarding experiences to be a part of that journey for a family.
Well, if you want to check out Hopebridge, the address is there on the screen, phone number and website. It's a beautiful website, and it's full of information too, correct?
Absolutely. One of the things that you can find there for sure is information about our insurance that we accept. So we accept Medicaid and most commercial plans. In addition to, we do have diagnostic services, so there's information on that as well.
You know what? You thought of everything. I'm so happy that you joined me today. It's always a pleasure to get to see you and hang out with you.
Thank you so much.
Guys, stick with us. We have plenty more to come on Good Day Live.